Hey everyone, Dr. Rhonda Patrick here, and today we're diving deep into something that almost everyone in the fitness and health community has heard about, but very few truly understand. Creatine. And not just any creatine dosing. What happens when you actually take 20 grams at once? If you've been sticking to the standard 5 grams a day, you might be missing out on some seriously powerful effects, both in terms of performance and overall cellular health. So grab a notebook, because by the end of this video, you're going to understand the science behind high-dose creatine and why it might change the way you approach supplementation. Let's start with the basics. Creatine is one of the most studied supplements in the world, and for good reason. It's a naturally occurring compound that's stored in your muscles as phosphocreatine. Think of phosphocreatine as a battery pack for your muscles. And when you do high-intensity movements like sprinting, lifting, or even jumping, your muscles need quick energy. That energy comes in the form of ATP, adenosine triphosphate. But your muscles only store enough ATP for a few seconds of maximal effort. That's where creatine comes in. By increasing your phosphocreatine stores, creatine essentially allows your muscles to regenerate ATP faster, letting you push harder, lift heavier, and recover more quickly between bouts of exercise. Now, the standard recommendation you see on the label is usually about 3 to 5 grams a day. And yes, that works over time. If you take it consistently for weeks, your muscles will gradually become saturated with creatine and you'll experience the benefits. But here's the catch. If you really want to supercharge that process, there's something called a loading phase. During a loading phase, people often take 20 grams a day, split into 4 doses of 5 grams for about 5 to 7 days. This rapidly saturates your muscles with creatine, and the benefits kick in much faster. You might be wondering, is 20 grams safe? And the short answer is yes, for healthy individuals. Research shows that high doses of creatine are extremely well tolerated. In fact, studies have used doses as high as 30 grams a day for short periods without serious adverse effects. The most common side effect people notice is mild stomach discomfort if they take it all at once. That's why I recommend spreading it across the day during a loading phase. Beyond that, creatine is remarkably safe. And unlike some other supplements, it doesn't tax your liver or kidneys when taken in normal or even slightly high amounts. But here's where things get really interesting. High-dose creatine doesn't just improve strength and power, it has benefits that reach far beyond the gym. So for example, creatine is critical for brain health. Your brain, like your muscles, relies heavily on ATP for energy. Studies have shown that creatine supplementation can enhance cognitive performance, particularly in tasks that require short-term memory, quick thinking, or complex problem solving. And the higher your creatine stores, the better your brain performs under stressful conditions. Another underrated effect of creatine is its impact on cellular hydration and protein synthesis. When you load your muscles with creatine, water follows. This isn't just getting bigger. Temporarily, it actually creates an environment in the muscle cells that promotes growth and repair. Your cells become more hydrated, your protein synthesis ramps up, and recovery is faster. This is part of why creatine is so powerful for athletes who train frequently or for older adults who are trying to prevent muscle loss. So by now you might be thinking, okay, 20 grams sounds intense, but what's the exact mechanism that makes it better than 5 grams? Well, it comes down to saturation. Think of your muscles like a sponge. Taking 5 grams a day is like slowly dripping water onto the sponge, and eventually it gets soaked, but it takes weeks. Taking 20 grams in a loading phase is like pouring a bucket on it. It saturates the sponge quickly, and you start seeing benefits in days rather than weeks. Now, before we go any further, I want you to understand that not all creatine is created equal. The most studied form is creatine monohydrate, and this is the one I recommend. It's cheap, effective, and safe. Other forms like creatine ethyl ester or creatine hydrochloride often claim to be superior, but research doesn't support that. Creatine monohydrate is king, and when you're talking about high-dose loading, this is the form you want to use. All right, Now that we've covered the basics of creatine and why a higher dose can be effective, let's dive into what actually happens inside your body when you take 20 grams in a short period. Understanding the science here will help you optimize the results and avoid common mistakes that prevent people from getting the full benefits. When you ingest creatine, it's absorbed through your small intestine into the bloodstream. From there, it travels to your muscles, where it's stored as phosphocreatine. The interesting part is that your muscles can only hold a finite amount of creatine. This is called muscle saturation. Once your muscles are saturated, taking more creatine doesn't give you extra performance benefits. It just exits your body through urine. That's why timing and dosing are critical. By taking 20 grams as a loading phase, you're quickly pushing your muscles to their maximum storage capacity. This is far faster than taking just 5 grams per day, which could take 3 to 4 weeks to fully saturate your muscles. Here's something most people don't realize. Creatine uptake isn't uniform across all muscle fibers. Type 2 muscle fibers, which are your fast twitch fibers responsible for explosive movements like sprinting and heavy lifting, actually take up creatine more efficiently. That means when you load your muscles with 20 grams, you're specifically enhancing the fibers that have the greatest potential for power output. If you've ever wondered why some people see faster strength gains with creatine, this is part of the reason. Your muscle fiber composition plays a huge role in your response to supplementation. Another key factor is insulin. Creatine uptake into muscle cells is enhanced by insulin. And that's why some protocols suggest taking creatine with carbohydrates or a protein shake. Insulin signals your muscles to pull more creatine from the bloodstream into the muscle fibers, maximizing your saturation. If you're taking 20 grams, so spread throughout the day, pairing each dose with some carbs or protein can significantly improve absorption. This is particularly important during a loading phase where the goal is rapid saturation. Now let's talk about some of the less obvious benefits of high-dose creatine. Beyond just strength and power, creatine has a profound effect on cellular energy and mitochondrial function. Mitochondria are the energy factories of your cells, and creatine helps maintain ATP levels even during periods of high demand. This isn't just important for lifting weights, it's critical for brain function, endurance activities, and recovery from stress or illness. There's emerging research showing that creatine supplementation can even protect neurons from oxidative stress and support cognitive resilience under fatigue. So taking a loading dose isn't just about getting jacked faster, it's about optimizing your energy metabolism at the cellular level. One common concern people have is water retention. When you increase creatine stores, your muscles pull in water, which can cause temporary weight gain of 1-3 kilograms. This is purely intracellular water, meaning it's inside your muscle cells, not subcutaneous bloating. In fact, this intracellular hydration actually promotes protein synthesis and muscle repair, which is why high-dose creatine can enhance recovery and muscle growth over time. Some people mistake this for fat gain, but it's actually a sign that your muscles are functioning optimally. Another important aspect is the neurological effect. Creatine isn't just stored in your muscles, it's also stored in your brain. Your neurons rely on ATP to fire properly, and creatine helps ensure they have enough energy during cognitively demanding tasks. Studies show that people who supplement with creatine perform better on short-term memory tests, reaction time tasks, and even mental fatigue challenges. Interestingly, vegetarians and older adults often see the most pronounced cognitive benefits, likely because their baseline creatine stores are lower. A 20-gram loading phase can rapidly boost brain creatine levels, potentially improving focus, memory, and mental resilience. Finally, let's address the safety concerns, because some people panic when they hear 20 grams. Research consistently shows that short-term high-dose creatine is very safe for healthy adults. Your kidneys filter excess creatine from the blood, and as long as you're hydrated, there's minimal risk. Gastrointestinal discomfort is the most common side effect, which is why splitting the dose throughout the day is recommended. Note Some people also notice mild bloating, but this is temporary and part of the water retention effect we just discussed. Now that we've covered the science behind creatine and what happens in your muscles and brain when you take a high dose, let's get practical. If you've never done a 20-gram creatine loading phase, here's exactly how to do it safely and effectively to maximize your results. First, dosing. A typical loading phase is 20 grams per day, split into 4 separate doses of 5 grams each. Why split it up? Two main reasons, and absorption and digestive comfort. Taking 20 grams all at once can overwhelm your gut and may cause bloating or mild nausea. Spreading it throughout the day keeps your bloodstream creatine levels stable and reduces gastrointestinal side effects. Ideally, take 1 dose in the morning, 1 pre-workout, 1 post-workout, and 1 in the evening. If you don't train that day, just space them evenly throughout your meals. Second, timing with food. As we discussed earlier, insulin improves creatine uptake into muscles. Pairing each 5-gram dose with some carbohydrates or a protein-rich meal can significantly enhance absorption. For example, mix your creatine with a fruit smoothie, oatmeal, or a protein shake. Even a small serving of rice or a banana can boost insulin enough to help your muscles pull in more creatine. This strategy is particularly important during a loading phase when rapid saturation is the goal. Next, hydration. Creatine pulls water into your muscle cells, which is part of what makes it so effective. But it also means you need to make sure you're drinking enough water. Aim for at least 2 to 3 liters per day and more if you're sweating heavily during workouts. Proper hydration ensures your kidneys can handle the excess creatine safely and helps prevent muscle cramps or digestive discomfort. Some people worry about kidney damage with high-dose creatine, but research consistently shows that as long as you're healthy and hydrated, creatine is safe, even at loading doses. Now, how long should you do the loading phase? Typically, 5 to 7 days is sufficient to fully saturate your muscles. After that, you switch to a maintenance dose of 3 to 5 grams per day to keep your muscles fully loaded. Some people skip the maintenance phase, thinking the effects will continue indefinitely, but that's not the case. Your muscles will gradually deplete their creatine stores over time, so consistent daily supplementation is key for maintaining benefits. Let's talk about performance results. Once your muscles are fully saturated, you'll notice several changes. First, strength and power output often increase rapidly. People can lift heavier, sprint faster, and perform more reps at high intensity. Second, recovery improves. Muscles fatigue less quickly and soreness is reduced, meaning you can train more frequently and with higher intensity. Third, you may notice subtle cognitive improvements. Tasks requiring focus, memory, or mental endurance often become easier, particularly under stress or sleep deprivation. Another advanced strategy some athletes use during loading is combining creatine with beta-alanine or citrulline malate. Beta-alanine helps buffer lactic acid in muscles, allowing for longer, high-intensity efforts, while citrulline malate improves blood flow and nutrient delivery. When paired with creatine, these supplements can have a synergistic effect, enhancing both strength and endurance. However, these are optional additions. The most important factor is creatine itself. It's also worth noting that the response to creatine is not uniform. Some people are high responders, seeing dramatic increases in strength and muscle size, while others are low responders. This often comes down to baseline creatine levels, muscle fiber type, and diet. For instance, vegetarians and vegans tend to have lower baseline creatine stores and often experience more pronounced benefits from supplementation, even if you're a low responder. A loading phase ensures your muscles are saturated and you're getting the maximum potential benefit. Lastly, let's briefly discuss creatine and sleep. Emerging research suggests that creatine may help buffer against some of the cognitive and physical deficits caused by sleep deprivation. By increasing ATP availability, your brain and muscles maintain performance even when energy levels are compromised. This is especially relevant for athletes, shift workers, or anyone occasionally missing sleep. high-dose creatine could be a tool not just for strength, but for resilience. Now, let's move beyond performance and recovery and talk about some of the most exciting, lesser-known benefits of high-dose creatine. Benefits that can impact your long-term health, brain function, and even aging. Most people think of creatine purely as a muscle building or strength supplement, but the research tells a much bigger story. First, let's talk about mitochondrial health. Mitochondria are the powerhouses of your cells responsible for producing ATP, the energy currency that drives every cellular process. As we age, mitochondrial efficiency naturally declines, which contributes to fatigue, slower recovery, and even age-related diseases. Creatine plays a critical role here by helping to buffer ATP levels. Essentially, it ensures that your mitochondria have a reserve supply of energy available when demand spikes. A high-dose creatine loading phase can saturate your muscles and possibly other tissues, creating a robust energy buffer. And over time, this may help preserve mitochondrial function, keeping your cells more youthful and resilient. Another powerful benefit of creatine is its neuroprotective properties. Your brain consumes a huge amount of energy, roughly 20% of your total ATP, despite only making up about 2% of your body weight. When ATP is low, neurons struggle to function optimally, which can affect memory, focus, and mental endurance. Creatine supplementation has been shown to increase brain phosphocreatine levels, effectively providing neurons with extra energy reserves. Some studies even suggest that creatine may protect against neurodegenerative diseases like Parkinson's and Alzheimer's by reducing oxidative stress and improving cellular energy. Homeostasis, high-dose creatine can accelerate this effect by saturating your brain and muscle stores faster than standard doses. Creatine also has implications for longevity. One of the mechanisms linked to aging is impaired protein synthesis and cellular hydration. By increasing intracellular water retention, creatine creates an environment in your muscle cells that promotes protein synthesis and repair. This doesn't just improve strength, it helps counteract sarcopenia, the age-related loss of muscle mass, which is strongly linked to frailty and reduced lifespan. So essentially, high-dose creatine could act as a protective agent for muscle tissue as you age, preserving mobility and functional capacity. There's also growing evidence that creatine may improve metabolic health by enhancing ATP turnover. Creatine can improve glucose uptake in muscle cells. This means that in combination with resistance training or high-intensity exercise, creatine supplementation could improve insulin sensitivity and glucose metabolism. This is particularly relevant for older adults or anyone concerned with metabolic syndrome, type 2 diabetes, or energy regulation. Saturating your muscles quickly with a loading phase may amplify these metabolic benefits compared to standard low-dose supplementation. Let's not forget mental fatigue and stress resilience. Creatine supplementation has been shown to reduce mental fatigue during demanding cognitive tasks. In practical terms, this means that during periods of sleep deprivation, high workload, or prolonged mental focus, you might maintain higher levels of attention, faster reaction times, and improved problem-solving capacity. The effect seems to be dose-dependent. Higher doses, at least during the loading phase, result in more rapid and pronounced cognitive benefits. This could be a game changer for students, professionals, or anyone needing peak mental performance under pressure. Another fascinating area is creatine's anti-inflammatory potential. Emerging research suggests that creatine may help reduce markers of inflammation in muscles following intense exercise. This is important because chronic low-grade inflammation contributes not only to muscle soreness, but also to age-related tissue degeneration. By taking a high-dose loading phase, you could be priming your muscles and tissues for faster recovery and less inflammation even before you hit your workouts. And finally, it's worth noting that these benefits are cumulative. You're not just enhancing strength, muscle growth, or cognitive function in isolation. Creatine is a multi-system supplement: muscle, brain, mitochondria, metabolism, recovery. and even long-term resilience are all positively influenced. High-dose creatine is essentially a way to rapidly supercharge your cells, providing an energy buffer that translates into both immediate and long-term benefits. All right, it's time to bring everything together and give you a clear, actionable plan for implementing a 20-gram creatine loading phase while maximizing safety, absorption, and long-term benefits. If you've been taking just 5 grams a day, this is where things start to get exciting. Step 1, the loading phase. For 5 to 7 days, take 20 grams of creatine daily, split into 4 5-gram doses. Spread these doses evenly throughout the day, for example, morning, pre-workout, post-workout, and evening. Splitting the dose is essential because it maximizes absorption while minimizing gastrointestinal discomfort, which is the most common side effect of higher doses. Remember, creatine monohydrate is the form with the most evidence behind it, so stick to that. Avoid fancy enhanced creatines. The science doesn't support claims that they're superior. Step 2, pair your creatine with food for optimal uptake. Each 5-gram dose should ideally be consumed with some carbohydrates or protein. This is because insulin helps drive creatine into your muscle cells. Simple examples include a banana, a piece of toast, a small smoothie, or a protein shake. Even modest insulin spikes are sufficient to improve muscle creatine uptake, which means you get more bang for every gram you take. Step 3, hydration. Creatine pulls water into your muscle cells, which is part of why it works so well. But this also means you need to drink enough water, at least 2 to 3 liters per day, more if you sweat heavily. Adequate hydration ensures kidney safety and supports muscle recovery and performance. If you're training intensely while loading, monitor your fluid intake carefully. Proper hydration also helps reduce the risk of cramps or bloating during this phase. Step 4. After the loading phase, transition to a maintenance dose of 3 to 5 grams daily. The loading phase saturates your muscles quickly, but the maintenance dose is necessary to keep creatine stores high over the long term. Skipping maintenance won't hurt you, but your muscles will gradually lose the extra creatine over a few weeks, and you'll see diminished benefits. Consistency is key here. Step 5, advanced strategies. Some people combine creatine with beta-alanine, citrulline malate, or even HMB for synergistic effects. Beta-alanine helps buffer lactic acid, citrulline improves blood flow, and HMB supports muscle preservation. These aren't required, but they can enhance results for athletes or anyone looking to push their training to the next level. Another tip, timing your doses around workouts seems to provide slightly better strength and recovery benefits, though daily consistency is far more important than exact timing. Now, let's address some common myths. First, creatine does not cause kidney damage in healthy individuals. Numerous studies, some lasting years, have consistently shown that kidney function remains normal in people taking both standard and high doses of creatine. Second, creatine is not just for bodybuilders or athletes. Its benefits extend to brain health, mitochondrial function, cognitive performance, and even longevity. Third, the idea that creatine causes excessive bloating or fat gain is misleading. The weight gain during bloating is primarily intracellular water, which actually helps protein synthesis and recovery. It's a good thing, not a problem. Another tip is to monitor your response. Some people are high responders and experience dramatic strength, power, and cognitive gains, while others are low responders. Factors include baseline creatine levels, muscle fiber type, diet, and age. Vegetarians and older adults tend to respond more noticeably because their natural creatine stores are lower. Regardless, the loading phase ensures that every individual achieves near maximal muscle saturation quickly, which gives you the best chance to experience benefits. Finally, let's talk about lifestyle integration. Creatine is most effective when paired with resistance training or high-intensity exercise, but the benefits extend beyond the gym. Cognitive performance, stress resilience, recovery, and even age-related muscle preservation are enhanced by creatine supplementation. Taking a 20-gram loading phase is a tool that gives your muscles and brain a rapid energy boost, which can improve daily performance, mental focus, and overall cellular health. So If you've never taken 20 grams of creatine before, now you have the blueprint. Start with a 5 to 7 day loading phase, split doses, pair with food, stay hydrated, then move to maintenance. Track your performance. Notice the changes in strength, endurance, and mental clarity, and be aware of how your body responds. This isn't just about lifting heavier, it's about supercharging your cellular energy, improving recovery, supporting your brain, and optimizing long-term health. High-dose creatine isn't just a supplement, it's a science-backed tool for maximizing human potential. And now you know exactly how to use it safely, effectively, and strategically to unlock the benefits most people never even realize exist. Your muscles, brain, and mitochondria will thank you.